from Johns Hopkins University. However, the World Health Organization is estimating the actual figure could be almost 3 times higher than that, higher than the figure the health authorities are suggesting. The virus was first identified in the Chinese city of Wuhan in December of 2019. Almost 250 million infections have since been reported globally. In a statement, the UN Secretary-General Antonio Guterres said, "This devastating milestone reminds us that we are failing much of the world. While wealthy countries are rolling out third doses of the COVID-19 vaccine, only about 5% of people in Africa are fully vaccinated. This is a global shame." Here's Priyanka Gupta.
People gasping for air, families torn apart, and governments forced to close borders and order millions of people to be confined to their homes. The COVID-19 pandemic has now killed more people than any other viral epidemic in the 21st century. But almost 2 years since the first case emerged in China's Wuhan province and a new coronavirus spread rapidly across the globe, effective vaccines developed at a record pace seem to be having some impact.
At the moment, that average number of daily deaths worldwide is lower than what we were seeing last year. And a lot of that could be attributed to a combination of vaccination, people understanding how COVID infects people and what they have to do to control it.
But in Russia, which produced the world's first domestically developed COVID-19 jab, many people are reluctant to take it. And that's leading to a record number of deaths. And after the initial optimism of a fast vaccine rollout in the UK, other parts of Western Europe and China, infections are rising.
It'll be very interesting to see what happens in the Northern Hemisphere as, by and large, many countries have no restrictions at all now. And vaccines are, obviously the whole population's not vaccinated. And as they go into winter, people are closing their windows and their doors, and there's a higher risk of transmission in both households and businesses and social settings. So I think we're about to learn a lot, and that is how much we can rely on the vaccine.
While richer nations are racing to give booster shots, poor countries, particularly in Africa, are struggling to get supplies of vaccines, leaving millions of people vulnerable. Conflict and poverty have already devastated healthcare systems in Syria, Yemen, Haiti and the Democratic Republic of Congo, which have yet to vaccinate even 5% of their populations.
The lack of vaccination in the poor world has a huge impact in 2 ways. For a start, many people are dying today that don't need to die. They're getting very, very sick, are losing relatives. We still have a situation where nurses and doctors in some of these countries are not even protected against this killer disease.
The pandemic seems far from over. But some countries like Australia, Thailand and Cambodia are preparing for a new way of life, reopening their economies with more vaccines and fewer restrictions. Priyanka Gupta, Al Jazeera.